Smoking can have devastating effects on both expectant mothers and their babies. The harmful chemicals found in cigarettes can lead to a range of complications and increase the risk of various health problems. It is crucial for pregnant women to understand these dangers and take steps to quit smoking for the sake of their own well-being and the health of their unborn children. When a pregnant woman smokes, she not only exposes herself to harmful chemicals but also puts her baby at risk. Nicotine, carbon monoxide, and other toxins present in cigarettes can cross the placenta and enter the baby's bloodstream. This can impair the baby's growth and development, leading to low birth weight and an increased risk of premature birth. Low birth weight babies are more vulnerable to a host of health issues. They may struggle to maintain their body temperature, have trouble breathing, and have weak immune systems. These babies are more likely to suffer from infections, developmental delays, and learning disabilities. In some cases, they may be at a higher risk of sudden infant death syndrome, SIDS. Apart from the risks of low birth weight and prematurity, smoking during pregnancy increases the chances of other complications. Expectant mothers who smoke are more likely to experience ectopic pregnancies, placental problems, and vaginal bleeding. They are also at a higher risk of developing gestational diabetes and preeclampsia, which can have serious consequences for both the mother and the baby. The effects of smoking on the baby don't end after birth. Babies born to smoking mothers are more likely to have respiratory problems, including asthma and bronchitis. They may also be at an increased risk of ear infections, dental problems, and developmental issues. The chemicals in cigarette smoke are particularly harmful to the delicate lungs of infants, making them more prone to respiratory infections and impairing their lung function as they grow older. The dangers of smoking during pregnancy extend beyond physical health. Research has shown that children whose mothers smoke during pregnancy are more likely to have behavioral problems, attention deficit hyperactivity disorder, ADHD, and difficulties with learning and cognition. These children may struggle academically and have a higher likelihood of engaging in risky behaviors such as smoking themselves later in life. Quitting smoking during pregnancy is essential to minimize these risks and improve both the mother's and the baby's health outcomes. While quitting can be challenging, there are various resources and strategies available to support expectant mothers in their journey to become smoke-free. Nicotine replacement therapies, counseling, and support groups can all be helpful tools in helping expectant mothers quit smoking. It is important for healthcare providers to play an active role in identifying and assisting pregnant women who smoke. Providing education about the risks of smoking during pregnancy, offering resources for smoking cessation, and reinforcing a smoke-free environment can significantly increase the chances of expectant mothers successfully quitting. By quitting smoking, expectant mothers can greatly improve their own health and give their babies a healthier start in life. The benefits of quitting are evident even if done later in pregnancy. The sooner a woman quits smoking, the better the chances for her and her baby's health outcomes. In conclusion, smoking during pregnancy poses significant risks to both the expectant mother and her baby. The toxins in cigarettes can lead to low birth weight, premature birth, and a host of health complications for the baby. Additionally, smoking during pregnancy increases the chances of complications for the mother. Quitting smoking is critical to ensure a healthier pregnancy, improve birth outcomes, and reduce the long-term health risks for both mother and child. Healthcare providers and support systems play a vital role in helping pregnant women quit smoking and create a smoke-free environment for themselves and their babies. Secondhand and third-hand smoke can have a harmful impact on kids' health, so it's essential to protect them from these dangers. Secondhand smoke is the smoke inhaled by non-smokers from the burning end of a cigarette or exhaled by a smoker, while third-hand smoke is the residue left behind on surfaces after smoking. Both types can lead to serious health issues, especially for children. When parents or caregivers smoke around their kids, they expose them to harmful pollutants present in cigarette smoke. These pollutants can irritate the lungs, increase the risk of respiratory infections like bronchitis and pneumonia, and even cause long-term conditions like asthma. To shield children from secondhand smoke, it is crucial to make homes, cars, and public places smoke-free zones. This means refraining from smoking indoors, especially in enclosed spaces where smoke lingers, and never smoking around children. Third-hand smoke, which often goes unnoticed, presents an additional risk. The toxic residue from smoking accumulates on surfaces like furniture, carpets, and clothing and can linger for days, weeks, or even months. When children come into contact with these surfaces, they can unknowingly ingest or inhale the harmful chemicals. To minimize exposure to third-hand smoke, it is important to maintain a smoke-free environment and to regularly clean and air out areas where smoking occurs. For parents who smoke, quitting is the best way to protect their children. Quitting smoking not only improves the health of the parent but also reduces the exposure to second-hand and third-hand smoke for the entire household. There are various resources available to help individuals quit smoking, including counseling, support groups, and medications. By being mindful of the dangers of second-hand and third-hand smoke and taking steps to prevent exposure, parents can ensure a healthier and safer environment for their children. It's crucial to create smoke-free zones, quit smoking if possible, and be aware of the potential risks that cigarette smoke can pose to young people's well-being.